Let's start with something practice owners know but rarely discuss. You might have a full front desk, but your revenue cycle is likely bleeding money. It happens because the administrative side of medical billing is highly fragile, and those hidden cracks cost you. It is easy to assume healthcare staffing has stabilized, but the data shows otherwise. Recent MGMA reports reveal a 33.3% turnover rate for business operations support and 40% for front office staff. This chart reveals that replacing just one frontline support staff member actually costs between $25,000 and $30,000. When you look at your base salary line item, you aren't seeing this recurring penalty. And trying to retain experienced billers with traditional 2 or 3% merit increases fails when market wages for healthcare support staff are surging past those levels. When a practice loses 2 or 3 staff members in a year, those $25,000 replacement penalties aggregate. Factor in the revenue loss to collection delays during training, and the hit to the bottom line routinely reaches 6 figures, all without appearing on a single line of your P&L. This gets even more expensive when you use a specialized EMR. Finding billers who genuinely know athenahealth's distinct workflows, claim submission protocols, and payer rules is a massive hurdle. When you hire someone, the learning curve is steep. It takes 60 to 90 days before a new hire is productive on athenahealth. For 3 months, you pay full salary, while claims go out slower, follow-ups lag, and accounts receivable climb. Practice managers across industry forums constantly point to the training spiral. They invest 3 months training a new biller, only to have them leave for a remote job. Then the clock starts over. athenahealth requires a highly specialized skill set. Paying fully loaded employment costs during a 90-day learning curve drains your cash flow before your new hire even hits their stride. Even if your billing desk is fully staffed and perfectly trained, the external payer environment is actively working against them. The job is mathematically harder. According to 2024 Kodiak Solutions data, the initial claim denial rate across the industry has hit 11.81%. Medicare Advantage denials alone spiked by nearly 5% in a single year. It is an industry-wide squeeze. Recent surveys show that 84% of healthcare organizations now view reducing denials as a top operational priority. This chart shows the exact cost of that squeeze. Reworking a single denied claim consumes between $25 and $181 in staff time alone. Multiply those rework costs across the sector, and this exact bottleneck creates an estimated $262 billion annual loss. This is why just hiring a good biller fails. An isolated human at a front desk cannot efficiently fight off an 11.8% denial rate without dedicated, expensive rework bandwidth. The Healthcare Financial Management Association sets the healthy benchmark for days in accounts receivable between 30 and 40 days. Yet understaffed practices are routinely hitting 60, 90, or even more days in AR. Look at the daily requirements for an athenahealth specialist. They have to scrub claims constantly before submission, while tracking payer-specific rules that change with almost zero notice. They also have to verify eligibility before every visit. Missing the single 5-minute front-end step accounts for roughly 22% of all preventable denials. Then there is the aggressive back-end workflow, managing 30, 60, 90-day aging buckets, handling appeals with proper documentation, and interpreting ERAs to reconcile payments. Forcing an in-house biller to squeeze dedicated denial management between greeting patients and answering phones transforms a minor staffing gap into a major financial crisis. To solve this, a growing number of mid-size groups are pivoting away from standard hiring.
They are outsourcing to EMR-specialized billing services like Staffingly. Instead of managing raw recruits, the practice connects directly with AAPC and AHIMA-credentialed specialists. There is a clear operational trade-off here. You surrender the physical presence of an in-house employee. In exchange, you get immediate, native athenahealth expertise working directly inside your actual system. Looking at this comparison, the financial math is straightforward. Hiring an in-house biller costs between $55,000 and $75,000 per year when fully loaded with benefits, taxes, and turnover costs. A dedicated specialized seat with Staffingly costs $399 per week. That $399 weekly fee totals roughly $20,700 a year. That yields up to $54,000 in pure annual savings per position, compared to the high end of your in-house costs. Specialized outsourcing converts a highly volatile six-figure fixed overhead into a predictable, highly efficient variable cost.
You also bypass the traditional 90-day internal training ramp. The implementation speed with Staffingly includes a strict 14-day go-live guarantee, moving from kickoff to pilot in 2 weeks. This speed allows for strategic role separation. High-performing outsourced teams dedicate specific bandwidth to aggressive denial management, separate from daily claim submissions. And these remote specialists use native EMR workflows. They operate directly inside your actual athenahealth system, not through clunky screen share workarounds. If your patient volume fluctuates, the model scales with you. You can easily add seats with 30 days notice, or replace any team member within 48 hours without any HR friction. Eliminating the training spiral and capacity bottlenecks protects practice growth in a way that goes far beyond simple hourly rate savings. It's natural to be apprehensive about moving financial data outside your office. That's why rigorous, third-party audited security infrastructure is essential. Foundational compliance protocols are implemented from day one. This includes standard business associate agreements, encrypted VPNs, and disabled USB ports at biometric secure facilities. This security is actively third-party audited. The infrastructure holds strict certifications, including SOC 2 Type 2, ISO 27001, and HITRUST. Beyond security, there is an AI augmentation layer. Smart routing ensures specific claims go directly to the team member best suited for that exact payer's rules. As you can see here, automated AI audits function as a final safeguard. They catch human errors and missing modifiers before claims go out the door, aiming directly for the industry benchmark of a 98% clean claim rate. Combining credentialed human expertise with AI-driven pre-audits and HITRUST security creates an operational standard that is nearly impossible to replicate inside a small private office. These workflows are highly mature, actively serving over 800 practices across every U.S. state. Vague daily check-ins are replaced with transparent, CFO-friendly weekly KPI reporting. To be clear, massive hospital systems with proprietary billing departments do not need this service. This is built specifically for mid-sized practices whose athenahealth billing is consuming vital management bandwidth and generating 60-plus day AR backlogs. As a practice owner, you have a choice. You can hold on to the illusion of physical control over a volatile in-house staff, or you can take total control over your cash flow and financial stability. Exploring this shift carries zero risk. There is a 30-day free trial available and absolutely no long-term lock-in contracts. You can run the math for yourself. Book a brief strategy call today to rescue your revenue cycle at staffingly.com/demo,